Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. My name is Vicki and I'm the CEO of a primary care organization that provides for people of all ages, all denominations, all insurances or lack of insurances, whether you need medical, dental, behavioral health, or pharmaceutical support, we're here for you. So if you are looking for a primary care provider, just give us a call at 257-8224. And today I am so pleased to have one of our long-term staff members, Bonnie Andrus, and she is our infectious disease coordinator. So we're going to spend today talking about a fairly common and more recently curable disease, hepatitis C. So welcome, Bonnie.
Well, thank you for having me on today.
Now, as an LPN, you are our infection disease coordinator. So how did you get to that because there's a wide variety of things that our nurses do, and you kind of honed in on that. Tell us a little bit more about that.
Okay, so about 5 years ago, I started with TCCH, and as a clinical care coordinator, I was working with the DON, and so they sent out lists of people who were diagnosed with hepatitis C, and we were recently trying to reach out to them because of the new medications that were available to see if we could get them interested in getting treatment. So as we started rolling that out, I realized that this is something that I already dealt with as a nurse when I worked in Pennsylvania in the jails. And it was easy for me to just transition, pick that up, and move on with it. So it was quite interesting and very easy to deal with.
So infectious diseases, you are saying by reference, are fairly common in a jail setting as well.
Oh, yes.
Okay.
Yes.
But hepatitis C does not necessarily mean that you're of the criminal element or that you have touched something, spread something on purpose that's bad for you.
No,
is that correct?
Not necessarily. It's something that everyone should have a base screening.
Okay.
And our policy is that if you come to TCCH, we do base screening on hepatitis as well as HIV to make sure that we have a baseline for you.
Because it usually has no symptoms?
Right. There are no symptoms to hepatitis C unless it's to the last stages.
No, we don't want to wait till then.
Right. And then by most chances, it's too late to get treatment. But it is curable. The medications available are wonderful for care and treatment, and it takes as little as 6 weeks to 12 weeks to get treated.
Wow. And, I was just commenting that for a while we saw all kinds of advertisements from the various pharmaceutical companies about different medications, whether they were for diabetes or hepatitis C, things like that. And I haven't heard anything recently about that. But during that spell, it seemed like they were really targeting people that were 45 and up.
The baby boomers.
Is there a reason for that?
Well, you think back to the summer of love and how everyone was free and easy going. So it's not just spread by needles or any kind of illicit drugs. Anyone can pick up hepatitis C. It's something that stays on the surface for up to 12 weeks. It can live. So it's easy to pick up, but it's also curable now.
And as you said, those that are not picked up early on, then I assume that this is really a liver type of disease?
It is. It does attack the liver. And so that's why when we do testing, we also include liver enzymes. We include a fibrosis score, which tells us if you have a liver disease, you can still be cured as long as it doesn't reach the stage of scarring, which would be a stage 3 or 4.
Scarring of the liver.
Scarring of the liver.
Okay.
And if it does reach those stages, we would just refer you to a gastroenterologist. They would do further testing. And for the most part, most everyone is received for treatment. And if not, then the gastroenterologist would be the one taking care of the situation.
And we have that affiliation then at Cleveland Clinic and other local hospitals?
Yes, we basically, the one I deal with is the Cleveland Clinic. We do have other gastroenterologists in the area that will treat for hepatitis C. And if you have no insurance, if our patients don't have the money for the lab testing, which some of it is quite costly, we recommend that they enroll in the financial assistance program through Cleveland Clinic. And then they get their testing done, and we follow up with them. And we take care of them from beginning to end. We make sure that they're totally taken care of.
Regardless of insurance status?
Yes.
Okay. So in that particular case, if they got the lab work done at Cleveland Clinic and it said, yes, treatment would be in order, and they're uninsured, then how do the medications get paid for?
Most of our medications are two main forms of medication we use. We use Mavorite and we use Epclusa. Both manufacturers have a patient assistant program.
Okay.
And I would be the one working with them. I would reach out to them, ask them if they want to be treated. If they do, they come in, sit down with me, get educated on the medication, the side effects, and how to go about getting the medication for free.
Okay.
Once we get the medication assigned to them, we fill out the application. I walk them through every step of the way. I order the medication for them. I'll call them when the medication comes in, and we meet every 4 weeks to get till their completed treatment.
Is it a long turnaround, that whole application process, going out to the drug manufacturer and asking for financial assistance, basically samples?
No, it takes from 2 days to 2 weeks.
Okay.
To totally get the medication in the building.
Because I know in previous years, when people have said you need to do this or that, and a period of a week or 3 weeks go by, I find myself getting more and more anxious. Like, let's take care of this.
Right.
But that is not a long, protracted term.
No, it's not an issue with that.
And are there many side effects to the medications?
The two common side effects are headache and sleep. Some people get sleepy with the medication. So we ask them to, maybe if you can't take it in the morning, take it in the evening.
Okay.
And take it and drink plenty of water.
So they're like tablets?
Yes.
Oh, even better than shots.
Right, right.
Okay. And are there any, I guess it goes with the education, that they are still contagious until the end of their treatment?
Yes.
To protect their families or coworkers or anyone else?
Well, for the most part, when they start treatment, within the first 4 weeks, the viral load is undetectable. And that's what you need to see. If the viral load is undetectable, then they are not infectious. But we recommend that they continue taking the medication for the extended 8 weeks or 12 weeks, whichever the doctor has ordered for them.
Okay.
And the reason for that is we want to make sure after their 12 weeks or their 8 weeks, we wait another 12 weeks and do lab work. And that determines that the virus has been eradicated.
Because it would have had time to reflourish.
Yes.
Okay.
Yes.
Okay.
So we recommend that that period of time that they do not share
beverages
or
because I'm assuming it's through saliva or any body fluid, tears.
It's through blood, basically.
Oh, okay.
So they just need to make sure that they're using protection.
Okay.
If they're married or if they have a partner. And we also recommend that the partners get tested just to make sure that there's no spread of the disease, and we can take care of it for them.
So again, if they're not a patient already of Treasure Coast, they just come in for a regular visit with their doctor and then let them know that that's the reason for their visit.
Yes.
Okay. So tell us a success story. I know you've been doing this for a while.
Okay.
Anybody stand out?
Yes, there's one individual who She had been trying for, I think it was 4 years to get treated. Wow. And she would meet roadblocks because she had no insurance or she couldn't afford the labs. Whatever the case may be, she had issues with that. And when I got in touch with her and asked her if she wanted to be treated, she said, I've been down this road before. It's not
going to happen.
It's not going to happen. And I said, why don't you give me a chance? So we got her connected with financial assistance through the Cleveland Clinic, got her lab work done, got the okay to go ahead and treat her, had her come in, had her sign all the applications, got her started on the medication. When the medication was, I called her and told her when her medicine was in, she said, no, it can't be in. And I said, yes, it's here. You come by and pick it up. 4 weeks later, she came in for her second box of medicine. 12 weeks later, called her, had her come in for her labs, and she was cured.
Oh, that is wonderful.
Yes.
You know, the Cleveland Clinic gets a lot of criticism for a lot of the things they do, but their financial assistance program has helped so many people back on the pathway to health care.
Yes,
whether it's for labs or radiology work or that. So we're most appreciative of that partnership with them, because when you think about this woman struggling for so many years, and really the holdup, the biggest holdup was just ensuring that the labs were done and that she was therefore eligible. I'm assuming that that's the whole reason for the labs, is to get a baseline and figure out where she stands, and that her liver is, as you said, not in a compromised position.
Right.
That it can be cured. So that's awesome. So we're going to take a short break for a word from our sponsors, and then we'll come back and we'll talk to some other aspects of infectious diseases. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Time to take on those spring projects. Sturgis has lumber, hardware, and paint supplies. There's no reason to go out west to the big box stores. Sturgis is at 4645 US 1 Vero. Forget that traffic and shop local. Sturgis Lumber and Hardware. More than just lumber.
Start your day with fuel in your tank with breakfast at Marsh Landing. You'll love our biscuits and gravy, sweet potato pancakes, or eggs Benedict with a fried green tomato. And how about a mimosa or a monster Bloody Mary? It's breakfast, old Florida style, at Marsh Landing in Fellsmere.
Is owning a home your goal? With the rising cost of rent, you could be saving a lot of money by owning your own home. At Caliber Home Loans, we can help make home ownership a reality. Meet with us for a free consultation and get on the right path to buy the home of your dreams. For Caliber, home loans is all we do. We use local appraisers and offer a variety of loan options to fit your lifestyle and budget. Call us today, 844-GO-CALIBER, license number CHL 15622, Caliber Home Loans, TreasureCoast.com.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, including lots of slipcover styles from Universal Upholstery, Four Seasons, and Capri. We also have a gallery of Tommy Bahama and Lexington furniture designed for a relaxed approach to the finer things in life. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach next to Planet Fitness. Visit our website at sunshinefurniturecasual.com and also visit our outlet and closeout store directly across the street.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine Furniture, stop on in today and have a sunshine day.
And welcome back to Community Conversations. We are talking today something medical. I know that's really unusual, even though we are a primary care provider for all ages and all locations within Indian River County, of which there are 8 now and soon to be expanding again. because we want to make your access to our healthcare as convenient as possible, as thorough as possible. And so we have these discrete sites, each with its own on-site board-approved physicians, registered nurses, LPNs, and other support staff to take care of all of your needs. So don't hesitate to reach out. Today I am talking, if you're just joining us, with one of our LPNs. Bonnie's been with us for 5 years, and she has the official respected title of Infectious Disease Coordinator. And so she was a huge help during our infectious disease COVID battle, and still continues in that role, but has, since almost the beginning, helped us with our infectious diseases, primarily these days with hepatitis C, although there will be another announcement coming soon, I think. But hepatitis C, back in my day, was little thought of. Hepatitis B, we all knew if we got a poke with a dirty needle from a lab draw within the centers, then we could be subject to acquiring hepatitis B, and that is still a concern. But the real silent concern that has affected so many more people is hepatitis C. And for years it was, why should we test? And even today, I think the attitude of many people is, I feel fine. Why test? What's your answer to that, Bonnie?
Well, the answer to that is that it is a silent disease. Most of the time, you don't have side effects. So it is something that you should have a baseline, at least a baseline hepatitis C and HIV test completed, just to be on the safe side.
Because it is a silent
Because
thing.
Yes, and you, if you are newly infected with Hep C, you may have flu-like symptoms.
Oh.
But if it's something that's been laying dormant in your system, so to speak, it does affect the liver, and as you get older, it can cause liver cancer.
Ooh.
So that's one of the reasons the push to get people treated for hepatitis C. It's treatable now, and there's no reason not to get treated. If you have insurance, then you would see your primary care physician or go see your specialist, a gastroenterologist, get a referral. And we had touched on the gastroenterologist, and we talked about if they have a fibro score of 3 or 4, we do refer them to a gastroenterologist.
And that is what? The clotting factors that the liver produces?
That is the scarring of the liver.
Ah, the scarring itself.
Yes.
Aha.
So we recommend them to the gastroenterologist, who would further work them up, maybe do an ultrasound.
I was going to say, how do they know the liver's scarred? For us laymen that are really not involved in that, how would you know?
The fibro score is one indicator. Excuse me. But the other is they would do an ultrasound of the liver and actually see how firm it is.
Mm-hmm.
Excuse me.
Okay. So you work in conjunction with the GI specialist as needed.
Yes.
Oftentimes you're taking care of them. If they get a referral for a GI, does that mean then that care is transferred over to them?
The care is transferred over to them. However, I don't leave that chart go until they're totally healed.
Okay.
And I follow with them until they're healed.
That's awesome. Would you like a drink of water?
Please.
Sorry, I often have that problem. That's why we keep water in the studio. It's okay. So the got me a little distracted now. That's okay.
Sorry.
That's all right. Don't cry. It'll be okay. No, it's the throat. I know. So how many people typically are you handling at a time? Is this like, a couple of people, or how many, because of the stigma? I mean, I can't imagine going home and saying, I have hepatitis, because that does sound like you've been up to no good.
So on a weekly basis, I will have at least 3 different charts open that are patients who have hepatitis C, and they're in some stage of getting their workup completed, or we're starting the medication.
And the medication can be quite expensive if you were to go to your pharmacy and say, what would it cost for a treatment?
Yes, it is extremely
So don't
expensive.
do that. Ladies
Yeah.
and gentlemen, don't do that.
Yes, no, there are ways around it. And then there are those people who also can't even afford the copay. I had one woman contact me and say, "Why would I get this medicine? My copay is $1,500. I can't afford that."
Oh,
But they
goodness.
also have a program out there so that you can pay as little as $50 for your copay. But I never let them go by themselves through any of this. I'm with them every step of the way. We
That's
start
wonderful.
the process and I see them through. I'm the one who makes the phone call to them and tell them that the virus has been eradicated.
And that's got to feel awfully good.
It does. It feels great to be able to help these people in this community.
So you do a lot of education for our patients as well, don't you, about
Yes.
infectious diseases in general?
Mm-hmm. Yes, I do.
Okay. I know that I'm not going to defer off to some of the other infectious diseases, but we know that HIV is unfortunately still a problem. We're trying to eradicate that. Syphilis has made a comeback, and although that is not an infectious disease viral, it still gets traded around quite a bit more than we would have expected. So you have other colleagues within the organization that helps with all of those different things as well, do you not?
Yes, we do.
Okay. So if someone was hearing about us for the first time and they need a medical appointment, can they go to your location, or does it not matter? Can they just pick the one that's closest to home and then go through the battery of tests with their own personal provider?
They can try any one of the Treasure Coast Community Healths. They can call in, make an appointment, get seen, tell them that they think that they have maybe been infected with Hep C, or in some cases, they've been infected with it for years and they just need to know, where is this virus now? And now that you can treat for it, how do I go about getting treated?
Yeah, because you're right. Some people were told years ago that they had it, but there was nothing that could be done.
Right.
And so it's not too late for those folks as well.
That's correct. It is not too late.
Okay, that's an important message. So if you, in fact, are affected or have family members, dig back in the recesses of your mind. It's not too late to take a look at the cures as opposed to playing the odds against something like liver cancer, ultimately. So thank you so much for being here today. I really appreciate it.
Mm-hmm.
Anything that you want to share before we wrap up?
No, there's nothing.
You've done a great job for your first time here, and I so appreciate your sharing that information with us. Thank you. And thank you all for being here with us. Again, not to pitch Treasure Coast Community Health, although obviously I think they're a great organization filled with wonderful people who really have your best health in mind, but also just your health is the best thing that you can do for yourself as you get older, as your children start to age. So don't neglect it. There's always ways around the cost and the difficulties that you might encounter as barriers. Let us help you. And that's it for today. Have a great afternoon. Bye-bye.